Welcome to Inspiring Heartfelt Conversations. My name is Barbara Morningstar. This series is presented by In Autumn's Cocoon, which offers education on a range of end-of-life topics in the form of talks, workshops, and writings. For more information, you can go to inautumnscocoon.com. Our topic today is healing and healing connections in palliative care. And my guest is Dr. Daphne Lobb. Daphne has been a palliative care physician in Vancouver, BC for over 30 years. She led the St. Paul's Hospital Palliative Care Program for several years, worked at Canuck Children's Hospice, and works presently in the Richmond Hospital Integrated Palliative Care Program, providing care in hospital, hospice, and home settings. She teaches widely on many issues related to living and dying well with cancer, and is committed to helping people find ways to maintain a good quality of life. She is a co-founder of Callanish Society, a nonprofit organization based in Vancouver, and has co-facilitated week-long retreats 4 times a year since 1997. So lovely to have you here for this conversation, Daphne.
Thanks, Barb. Nice to be with you.
Yeah. Okay, so I want to start by defining a few things because terms come so natural for us by being in the arena. So what do you mean by whole person care? Let's start there.
Good question. Well, I think that as a physician, medical care, often we focus on the body and symptoms. And so whole person care, I've learned over the years from my palliative teams is about looking at all the domains of a person that makes a person whole. And that is the spiritual, the physical, the emotional, the social, who is it? Who are they really, and what's important to them? And so it's how we find meaning. It's our humanity. So that I think that is whole person care. And I think the system that we work in with all the stresses, especially now post COVID and shortages, we can miss so many aspects of that whole person care when we provide care.
Beautiful. And whole person care is woven into the palliative care philosophy, right? So
I think that's why I work so much.
Sorry, go ahead.
I think that's why I love the work so much, and actually what drew me to it in the first place.
Okay. That was actually going to be my second question. What drew you to it? But we'll hold on that for just a second. So the title is Healing and Healing versus Cure. But so many people go, what do you mean? It's a life-threatening illness. How can there be healing? So what do you mean by healing and healing versus cure potentially when there's a life-threatening illness?
Well, I think healing is always possible. And so, but curing isn't always possible. So the difference is that, and again, it relates to the whole person care, is I think healing is how we find our wholeness, how we find our humanity, how we find meaning. What can connect us more to that is a healing experience. And I think we can heal right up to the time we die. And curing is really focusing on the physical illness and combating that, stopping that. So healing is so much bigger, so much broader, and has so much more potential, actually. And I think that's, again, that concept is what keeps me well in this work, because otherwise if we were only focusing on curing, my work would be very depressing. But I don't find it that way at all. I find it very inspiring because of that notion of being able to heal until we die.
Well, and then again, leading into, you talk about that is what called you to be a palliative care physician in many ways. Is there anything else you want to say around that?
Well, I think you alluded to that whole person care in terms of a team model too. And when I first was asked to come and spend some time on the palliative care unit at St. Paul's Hospital many years ago, at first anxiety came up in me, like, oh, I don't know anything, and that's such intense work, and oh my goodness. But something drew me to try it. And when I did, I met these amazing colleagues, Jackie Fraser being one, who started palliative care in British Columbia. She's kind of like Belmont's equivalent in British Columbia. And she was an amazing mentor, she and Millie Cumming and David Kuhl. And they brought me into this team model, which, through my training, I didn't experience that. And I met incredible nurses who were so experienced, so open-hearted, and occupational therapists that were just, I didn't even understand what an occupational therapist did, let alone kind of how impactful they can be to a person's healing and sort of quality of life. And the music therapy. And so we had all this amazing team around me. And so I didn't feel alone in the work. I think so often prior to that, and I didn't have a long time. I found palliative care very early in my career, thank goodness. But I didn't have a long time kind of working solo. But I did have enough time to feel the potential loneliness of that solo family practice. And I felt immediate connection with this team and just so drawn to that model. And realizing that my nature, I'm not really, I'm less a leader. I'm way more of a team player. And I work, my best work is done in teams. And I've not realized that early in my career. And I just surrounded myself by amazing people.
It's beautiful. So then there was another turning point where Dr. Rachel Naomi Remen's work, and she's a physician and the author of books like Kitchen Table Wisdom and My Grandfather's Blessings, which are a collection of stories which I have read and been inspired by too. What drew you to her work, and how did her influence in the work at Commonweal impact you as you started to develop more programs into the future?
Well, it was 1996, and I'd only been in the work for about 5 years by that point. I was working at St. Paul's, and I met Janie Brown, who is an amazing person. She's a therapist, a nurse, an author, and my beloved partner. Lucky me. So I met her, and she had been to Commonweal, and she'd seen a Bill Moyer series, Healing in the Mind, years and years ago, outlining this amazing retreat program that happens in California called Commonweal. And Michael Lerner and Rachel Remen were the originators of that program, the founders of that program. And she'd been down recently, just as we met, to meet them and to learn about this retreat program that she was interested in. At the time, she was a nurse at the cancer agency. And like me, realized that the working in the system, that whole person often the whole person care part goes missing. So she was looking for sort of more inspiration and different ways of being in the work. And she brought this retreat program back and wanted to start it up. And so she introduced me to the possibility of creating this together, which we did do, which you alluded to as Callanish Society. We started in 1996 or 97. But with that came my introduction to Rachel Remen. And she's the amazing physician that was part of that original seed. And she also did work with physicians to help us heal from our training. I love that. Heal from our training. Wow. I felt my training was fairly traumatic too. And so I could kind of go, wow, I can relate to that. And then when I looked more into her, I don't know that we could Google at the time. It was so long ago, but I found out about her. And she was doing workshops on things like finding our compassion, resilience, staying well in the work, how do we deal with our grief, all those things that, you didn't learn in med school. And I was drawn to that. And also those were themes that we were wanting to incorporate into our retreats. So it was perfect timing for me to sort of start the retreat program with Janie, but also to improve myself as a physician and to get that kind of support and training. So I went down to California and did a number of workshops with Rachel in the early days when they were they had a model like the retreat where they would bring 8 participants together. They brought 8 physicians together all different types of backgrounds. I was with a surgeon, a gastroenterologist, oncologist, family doctors. I remember those people so well, way back. And we sat in circle together. We went on a retreat, a shorter retreat, like sort of Thursday to Sunday, and did all kinds of exercises looking into those aspects of ourselves. And it was really profound work, and something I just had never been exposed to in that medical setting. And she just became such a mentor to me. She hadn't written her first book yet. In fact, one of the stories in her first book is one of my stories. And she actually used several stories in that book. I can tell you they're the various doctors. She changed them she changed them slightly. So they're slightly different, but I can see all the different doctors from my group, their stories in there. And she was just creating that book at the time. And so Kitchen Table Wisdom has been, one of our Callanish kind of Bibles that we've used for years and years. And we, in particular, every retreat, we read that passage that she wrote called Just Listen. And so, I certainly brought her teachings and her work and her sensibility and her approach to so much of my bedside work, but also our retreat work. And then subsequently, we've gone on to develop workshops for healthcare professionals as well. And most recently, we just this past year, we did a physician writing retreat, narrative medicine. And it was wonderful. 12 physicians got together and we did some amazingly beautiful writing. So we've done workshops for oncologists and palliative care teams. And so we've really brought a lot of Rachel's work and then Michael's and Rachel's work in terms of the retreats. That format is beautiful and kind of all different kind of groups and settings. So yeah, she and Michael Lerner have been amazing mentors for me as well.
Well, and I just want to take a moment to honor both you and Janie for actually taking responsibility to do your own work, because it's felt and it's seen in the Callanish programs. You bring so many dimensions to it, the senses, the locations, your heart. And we talked about, before we came into the conversation, we were both in the arena of hospice palliative care, and I knew of you and I'd seen your work. We kind of flowed back and forth. But then when my husband was in the last months of life, you rotated onto the palliative unit as a locum for, a brief period, but he was a tough case. It was layered with different. But I was saying to you before we started, like you're just talking about listening. I remember coming onto the unit one day and he was in a bit more of a pain crisis that you were sort of strategizing on. And I remember you saying, oh yeah, I went into the room and he was sleeping. But I just decided to sit and just be present with him. And my first thought was, seriously, a doctor stopped long enough to just decide it wasn't, oh, he's sleeping, I can move on. Mm-hmm. And then you said, it was the way you said it, I don't have your exact words, but you just held space for him. It was almost like you were leaning into the silence to listen to the silence. And then you said he gently woke up and you were holding the space. And then there was this beautiful exchange. And I remember wanting to kiss you and hold you in that moment in gratitude, because he was in such a roller coaster that was unique. But you modeled that for me as the partner, because it's harder when you have an engaged thing with your own heart. You're closer to it. And you just reminded me that even though my love could support and help him, I had to give space for his journey too. I don't know how to explain it. You mirrored that to me in your example. You probably didn't even know that, but so that is an even deeper level of listening that you reminded me to bring to his bedside in a nuanced way with my love. So I thank you for that. Yeah, I really do. We said we wouldn't cry through this. I'm trying not to, but so now we're going to shift a bit, because Callanish is just a beautiful center, and you have all this wonderful experience, but we're going to move into a more personal transition and experience in your life. It's one thing to be a physician and a counselor and support to others, but then that's very different than being the patient and being on the receiving end. So what was it like for you to hear the news that you had breast cancer?
Yeah, well, certainly I think it's always shocking when you hear that, when you get that phone call or that information. It's always shocking. I kind of had a bad feeling. I just had a feeling that it might not be good. And I could tell when, excuse me, I could tell when I went for my imaging, like I had, mammogram, ultrasound, I could tell in the ultrasound that it didn't look great, and I wanted them to biopsy it that day, and they couldn't, or they wouldn't, and it was really frustrating. And so I was quite worried for quite a long time that the actual wait for the diagnosis was probably the most stressful time for me. But that being said, yes, I was absolutely shocked, just by, what I now have to undertake, right? And, interestingly, I had always been someone who was aware that I am no different than my patients. In my brain, I knew that. I tried to convey that. I often said, I don't think I have cancer, rather than I don't have cancer, because one doesn't really know. So I used to use that language. I don't think I have cancer. But I always knew it could be me. But until you have it, you just cannot get the feeling of what it feels like to actually have cancer, and suddenly you are one of them. There is no us and them any longer, even in your mind. So you feel it in your body. So I knew it in my mind, but not until I had cancer did I feel it in my body that we are the same. And it was interesting. I remember when I first got the diagnosis, for the first few days, I was kind of in a dazed state. I was driving around looking on the sidewalk, thinking, they don't have cancer and I have cancer. And I would think, I don't know other doctors, like none of my colleagues have cancer. Almost like in a sense of like, what's wrong with me? Why do I have cancer? And so that sort of initial phase was kind of like, the whole thing is like, it was about me. It was individual. I have cancer, and kind of comparing myself. And I spent a while in that state, and thankfully that sort of shifted. But that was the sort of initial feeling of like, wow, like it really had to sort of sink into your bones about, wow, what you're about to embark on. And I have never found the hospitals particularly healing. It's hard to work in the system. My Callanish work has always sustained me and helped me be in the system. So the thought of kind of going in as a patient too is like, whoa. It was scary, just not necessarily. You always think, what if I die? And at the beginning, you don't actually know what stage you are, or if you have metastatic cancer. You hope you don't, but you don't actually know until the biopsy, if it is done and reported, just where you're at. So the first stage is 2, you're like, I could die. So you do the whole kind of like, wow, okay, how would that be? Mm-hmm. So you kind of go through all that stuff in your mind too, until you get more information. But regardless that you've started this journey, whether you like it or not, and it's going to be difficult. Yeah. So that was my first kind of plethora of feelings. Mm-hmm. Yeah, lots of fear, tears, the sort of death comes up pretty darn fast and pretty close. Yeah.
So then you ended up having a surgery. Mm-hmm. And moving into treatments and dealing with the aftermath of the treatments too. Is there anything through that phase of the journey that you want to share as you're looking back that, gave you a deeper insight or reflection about yourself or healing?
Yeah, so I embark on it. Initially, you don't know kind of until they get more details after so I started out with my particular case. The lesion, the lump was small, and I found it myself. My mammogram did not find it. My breasts were, you've heard about dense breasts. My breasts are so dense that it didn't pick it up. That's why, mammograms aren't best test for dense breasts. But I fortunately felt it, and I felt it when it was fairly small. So anyways, I knew, so I had the initial lumpectomy surgery, and then they got more details. And a lot of the conversation till then was likely just radiation and tamoxifen, something like that. And that's the majority of early stage breast cancer is the case. But unfortunately, mine had a slightly higher grade. And when they do this kind of, they send it off and do a little screen and get a score, it tells you whether you need chemo or not. And sadly, I needed chemo. I had a high grade, so still stage 1 and early stage, but a higher grade. So that was sort of shook me. I just, the idea of chemo was really hard. All the things you hear and see from other, I'd seen a lot of patients go through it. So on the one hand, it was good. I'd seen a lot of patients go through it and do fine, but I also heard lots of terrible stories about how awful chemo is. So you just want to try and avoid it at all costs. So I had to then embark on chemo, and there were some decisions to be made about what type of chemo. And so of course I pulled all my doctors that I knew, oncologists I knew, to try and figure it out. And did have to go with quite a heavy duty chemo. One of the funny things is I'm having one of my chemos, and this volunteer comes in, and she's a slightly older woman, and she's got her dog, and she's visiting, and she says, "Oh, I had breast cancer, 20 years ago. And the good thing is all the treatments must be so much better now." Actually, I said, "No, actually, I'm getting what you had 20 years ago." And she's completely shy. I said, "Well, that must mean it works well." So there are new treatments, but some of the treatments have been around a long time, and so I was embarking on this treatment. And interestingly, Janie, my partner, had been a chemo nurse in her early career, and so she had given the medications that I was now getting, and she was accompanying me. So there were lots of feelings from both of us going through this. But what we did do, and what was so helpful for me is, and I'm an extrovert, so I need people. So we decided that we would call our friends, because everyone, I think a lot of the times people don't know what to do to help. They say, "I'd love to help," or "Tell me what to do," or they just don't know what to do or what to say often. So we just decided to call our closest friends together and just let them, tell them what was happening, what I was embarking on, which most of them knew, but also how they could help. And for me to figure out what would be most helpful for both myself and Janie. And so some of that was food, helping with food, especially on chemo days. Some of it was going with us for treatments. Thankfully, it was before COVID and we could do that. And some was just sort of hanging out with me because I'm going to be off work, and just to have some company. And so we were able to get really specific. And I think that was helpful. And hopefully it was helpful for my little posse of friends. One of my friends called it Daphne's Love Posse. And so they, and then the other thing I did, which was extraordinarily helpful for me, was I reached out to my Callanish friends that had been through it. Some of them were now on the board of Callanish with me. Some had become friends. Some were, many of them were past participants that had gone on to get involved in our organization. And they'd been through chemo, they'd lost their hair. I could just ask them and they could just tell me. Some had been through the exact same drugs. And I just got an amazing amount of confidence knowing they had done it. And feeling, so at the beginning, I was feeling so alone and like they don't have cancer and why me? And then I felt like, you know what? 1 in 8 women get breast cancer. Hopefully I can be that one, so 7 of my friends won't need to get it. Mm-hmm. And I just kind of took it on in this way, like I can do this, I can do this for others, and I can, like, these guys have been amazing and helped me. I can hopefully go on to help other people. And so I really changed in my feeling about it. And just sort of took it on in a whole different way. And actually was just mostly what others have commented on is they could feel my gratitude through it all. I think I went from fear and why me and almost shame that I had it, and no other doctors that I know had it, to being almost not proud, but completely kind of embodying it and feeling okay about it, and feeling the gratitude of these friends that have been through it. It's kind of these warriors that we can do it and hopefully do it so others won't have to. And there's something that just really helped me. And it also helped me with the whole losing my hair thing.
So I was going to just talk about body image. Yeah.
So losing my hair, that was a big one. And the other thing that was extraordinarily helpful was Janie being affiliated with a Commonweal, had been to a number of gatherings and workshops and talks with various colleagues of Michael and Rachel. And she met an integrative oncologist in Chicago, and Keith Block is his name. He's written a book. And so Janie said, you've got to talk to Keith, because the other thing when you go through treatment is, and you know this, and you probably experienced this with Gord, but is you go through the medical side and the kind of Western model of treatment, but you also think, what else can I do? And a lot of our patients go see naturopaths, and often you have this conflict between the naturopaths telling you to do this, and then the oncologist or the pharmacologist saying, don't do that, just, that might affect the chemo. And so I just felt really caught, like, oh my God, I want to do everything I possibly can to improve my outcome and to make this as good as positive and as successful an experience. So Janie said, look, consult Keith, do a phone consult to Keith Block and see what he has to say. And in the US, unlike Canada, he was trained in sort of the alternative naturopathic world and oncology. So he was oncology, he was prescribing chemo and all the alternatives. And he was amazing for me. And he gave me all kinds of tips about supplements, about simple things to do, like exercising before chemo to make it work better and to have less side effects, about how I could ice my hands and feet not to have neuropathy. I could potentially ice my head and not lose my hair. About 85% of the patients in their clinic don't lose their hair.
Oh, that's interesting.
It was really important information. And I decided that I could ice my hands and feet because I did not want neuropathy, and I didn't have a speck of it. With my second set of chemo drugs, I did that, and I decided I didn't want to ice my head. That would be like for hours and nights pad on. I just thought that would be too painful. Hands and feet, you can take a bit of relief, pull them out of the ice, and go. But so I didn't. So I did lose my hair, and I decided when I was going to lose it that I would. Had a friend who's an amazing hairdresser who he lost his hair because he had leukemia. So he offered to come over and shave my head for me. And it felt so right to have someone who actually knew what it was like. And then I invited a few of my friends that had also lost their hair to come and be present. And they were beautiful. And so we did that sort of just like kind of in a real intentional way. And it was so helpful. And then I got this little wig, and he kind of modeled the wig so it kind of looked like my hair. But I talked to so many people, and they said, you probably won't want to wear it because they're so uncomfortable. But I just had to get one. I wore it once. Yeah. And I tell that to people now. I don't know if you should even bother getting one, but I wore it once. And then I just decided, but the first time I actually wore it to a restaurant in Vancouver. And halfway through the meal, I went to the washroom, and I took it off. Walked out of the washroom with it off. It was just so hot and bothersome. And then, but it was a big deal to kind of do that the first time you do it. But once you do it, you just sort of I just felt it was almost like a badge of honor. And if people were uncomfortable with it, that's their problem, not my problem. And and then different people look at you, and you can tell they know what you're, they nod at you or something. You can just this understanding from certain people that have been there before. And I don't know. It really changed for me from a panic and a fear again to this feeling of connectivity and kind of like gratitude. It was really an interesting experience, but I was so grateful for it. And you know, kudos to Keith Block. I got through my chemo. I didn't vomit once. I can't remember being nauseated. It was incredibly, the things he asked me to do that I was able to do were incredibly helpful. I mean, it wasn't without being, you know, tiresome and, you know, difficult in many ways, but I didn't have a lot of the symptoms I could have had thanks to his guidance. Yeah.
Oh, that's beautiful. You're so resourced. Like community, we're going to talk about that in sort of domains of healing connections. But one of the things I really applaud you for is just how you reached out for support and help, and just the community that you've created to love you up. Like you said, your little love team working together. It's like, because, you know, so often people try to do it on their own, and it's been proven, we'll talk about it later, that when you have community and safe, secure attachment, it's a lot easier in many ways, you know? So
absolutely. I can't tell you, Janie just took on my treatments. I mean, I was so resourced, and I feel so blessed. Janie worked in that chemo room before. She knew the head nurse still was, you know, one of the nursing leaders was still there. It still didn't give me, I have to say, I didn't get any special treatment. I still had a different nurse every single chemo, which is absolutely ridiculous. I thought, oh, well, that's too bad. The same nurse isn't on. Well, then I see her later in the day and she is on, but they just don't give her to me. There were so many things that weren't helpful within the system that even, you know, and in fact, sometimes I think being a doctor made it worse because they were more nervous about putting my IV in and things like that. But the other thing is that, you know, I was so resourced. I had Janie with me when I was doing the second part of my chemo, which is the one that does the can give you quite bad neuropathy. Janie and Tessa, our massage therapist from Callanish, came to every treatment, and we would wheel in a cooler with ice and all these little ice packs for my hands and feet, and every single time we'd have to tell the nurses again, they go, oh, we don't do that here, you know. That study is done, and we don't do that. I said, well, I'm going to do that. And they'd like go, oh, and so they kind of give us the old eye roll, and we just were strong enough and in the system enough that we could just do our thing. But, you know, I imagine that would be hard for the average person to kind of take that on every single time and push their way through and just say, this is what we're doing. So yeah, I think that I felt very lucky and very privileged, actually, to go through the way I did. And I try and share that information with as many people as I can, encourage them to do the same. And I've lent out my hands and my feet packs many times.
That's beautiful.
Yeah.
Well, I think you're touching on a point too, which is why you do the education, I do the education. Most people don't know what they don't know. And even by being in the system, you know, me companioning my husband and having years and years leading up to it, I was still stumped a lot of times going, well, how do I traverse this? So it gives me even greater compassion for people coming in with no awareness, trying to traverse it. And the reason it's important to have advocates with you and really educate on what's available in support overall, right? Hospice societies and your physician and community organizations like Callanish are wonderful areas to go to learn about things you may not have even known you could access, right? So yeah. So so Janie's brilliant. She's a former oncology nurse, a counselor. You're coming in with your lens as a physician and all this background, but you're also human beings and you're a couple. And there's a deep bond between you that is beautiful. So how do you want to talk about how it impacted you as a couple to kind of traverse this together? Or what was the journey of healing like for you in the relationship? That's a big question. So this is, probably not an easy answer to summarize, but is there anything that you want to share in relation to that?
Well, yeah, it was, I mean, it's a big deal for every couple. And often I think the partner gets missed, that the focus is on the patient, and everybody's attention and care, it goes to the person going through the cancer. And often I think the partners get somewhat missed in their journey, and would be hard for them to even bring it forward because, obviously you need the attention when you're going through treatment. So I think that was something that we were sort of like, again, I'm sure Janie knew about that as a therapist, but then felt it, it's sort of that, it in your head, and then you suddenly feel it in your body in a different way. And I imagine, like, I feel different towards my patients now and closer in the sense of a shared experience. I'm sure that she probably feels the very same way in her therapy practice with partners and spouses of people going through it. So I think that the experience can only make us better at what we each do in terms of our profession. And then, I felt so dependent on her, and I was dependent, in many ways. I wasn't bedbound by any means, and it's certainly different than being in a palliative state where I knew I would recover. So that was, very different than many of the patients that I take care of. But interestingly, when you have a focus, and others have spoken of this recently, I was actually talking to another patient about this, how when you're focused on treatment, you have a plan and you have dates and you have it set up, and we had it all set up from the food and the company. And then when treatment's over, that is a difficult time for a lot of people. And I found the post-treatment phase the hardest for me personally, and the hardest for our relationship, because I was then left trying to figure out, who am I now? And you're never the same person. Even though I went through it, I would say pretty well in terms of my physical symptoms and my tolerance of it. I just took a while to figure out, who am I now, and to really feel the changes. And I felt quite lost and quite alone in it at the beginning, just because it was new territory. And it was interesting that Michael Lerner has become quite a good friend of ours, and he runs the Commonweal Retreat Program, and he invited Janie and I, because knowing that we are the ones that provide the support, how do we get support? And my Callanish team was amazing, my colleagues that do the retreats with me or with us. But Michael said, we would love to just give you this retreat for you as a couple. Why don't you come as a couple? And it was really generous and beautiful offer. And we kind of thought about it. Do we need it? Anyway, we decided to go. Like, who would turn down Michael Lerner? So we went down. I'm thinking probably 2 or 3 months after I finished all my treatment, when I was in this place of coming back to myself, this new self. And Michael does the retreats, did that particular retreat with Francis Weller. I don't know if you must have read some of Francis.
I'd love to have him on. He's beautiful, just a beautiful, man. Yes. And
we had met Francis before that at a kind of more of a meeting at Commonweal for all the people that share the work. And he's a lovely man. And so he happened to be the therapist on retreat. And I had a wonderful session with him where he talked about this. He described this liminal space. You're in this liminal space after surgery where everything's changed and everything's intensified, but you really have to mark it and acknowledge it and sort of take your time in it, even that it's uncomfortable. And so he gave me some ideas about coming back and kind of marking it. And so I did get through that, but it does take a while, and it was an uncomfortable place. And we were it was hard for me to describe it to Janie. And it was just just an altogether unfamiliar place. Mm-hmm. And it lasted for me probably almost a year after the treatment. And it means if you think your body's been radiated and you've been, chemo and your whole energy system, because we're not just our bodies, that gets affected too. Mm-hmm. Even if you keep a positive attitude and you feel fairly grateful and you haven't been super traumatized, it's just very different. And I did a lot of writing. I spent time on my own a lot. And I was going to go back into work, which part of me was looking forward to. The other part of me was mourning this kind of period where I had off work and very contemplative. There wasn't a lot of distraction because I wasn't even doing all the house things I normally do. I was really focusing on this inner part of me, which you don't usually get that much space and time. And Janie gave me that space and time to do it. And so, we don't have kids, so many people just wouldn't have that. And so it was really precious time. And part of me didn't want to lose that. I thought, oh, am I going to lose this feeling I have, this feeling I'm getting to know a different me? And I was kind of possessive, like I wanted it. So it was a very interesting time. And, it took a few years post-treatment to kind of get myself back. The other thing is the joy doesn't come back immediately. You think, oh, you're finished treatment, you should be happy. And I remember asking Tori and Allison, my good friends who are on the board of Callanish with me, and they'd both been through it, like, am I going to feel joy again? I said, yeah, but it takes a while. Trust me, you will, but it takes a while. And I was like, oh, thank goodness I'm not going crazy. I'm not being weird. This is normal. It's all normal. It's all normal. And so I was so grateful to have this wealth of experienced people to ask and tap into. But some people really don't know many people that have gone through it. So I felt lucky to have this Callanish community that so many in Circle had talked about so much. It just gave me the courage and the strength to kind of know I could do it. So I'm eternally grateful for my Callanish world and the past participants and my patients. And they just taught me it just gave me confidence that I could do it. Yeah.
Well, it's why I appreciate people like you coming on this series too, because just by telling your story, you know, to the public or a professional who's watching this, it can inspire an insight or a way to reach out that they may not have been aware of, as I said before, right? Just even doing this series for me has actually been quite healing, more profoundly healing than I thought. And just on the note of the caregiver, you know, you've come through the other side. You're healed now. You know, where you're not looking at a life-threatening situation anymore. Your body's healed. You've emerged as a rediscovery, a new identity within yourself, and with Janie too. After my husband died, I talked about one of the most intimate moments. He died in my arms. It was one of the intimate moments I've had with death, I think. Like, just metaphorically, here's my beloved, and he's dying in my arms. And it was peaceful, but it was on so many dimensions. And then I had all these dreams with him that were crazy. Like, they were just nonstop after I got home. And I thought I was integrating it well. And I didn't date for like 5 or 6 years. And then when I went to open up again to somebody else, whoa, all this, because I'd known a depth of love in those last moments that was so intimate and so vulnerable and so open. And then I went as I was opening up again, wow, like so much was getting triggered. And then I've had some time in solitude, in the last few years to really sit like you are. And I thought I finally realized that I had actually experienced a depth of intimacy and love that I'd never known before, even in the full range of my marriage. And he had opened. So I was trying to stuff myself back into a relationship the way I used to be.
Right.
And my heart had been changed.
Mm-hmm.
And so even that's interesting. That's why I was asking about you and Janie, you're processing it. How's she doing as the partner? Because each has been transformed.
And you can't go back.
You can't go back. And so I was so confused and conflicted in, as I entered into, my first significant relationship, because this old part wanted to sort of do it the way I used to. And the new part knew this. I don't even know how to tell you the depth of grace and love that I felt in the vulnerability. So how do you bring that trust and then be afraid that vulnerability in loving get up a lot of pain too? So just honoring that it's an emergence for both in what you experience, right? So you just sparked that in me. So I just thought I would share that. But
I think it is our vulnerability that helps us more deeply connect with others, whether that's our intimate life partner or whether that's my patients. That I think when we can be vulnerable, and that's the old medical model of these boundaries and this way of being professional can get in the way of actually loving your patients. Like I think that we can love our patients and that's okay. And I think that's kind of radical, but I think when when you can let yourself be vulnerable and you've gone to those places in yourself, you can see it in others and you can feel more connected and you can truly love them like we should love our fellow human beings. And so that vulnerability is important. However we find that, whether that's in illness, whether that's in grief, however we find our trauma, or however we find our vulnerability, we can only be better for it.
Well, so as you emerged out of this and your body was healing and you're in a good place with your health now, COVID hit. You got this package of life events.
Yeah.
And so you've touched on how it has changed your practice as a physician. Is there anything else that you want to speak to in relation to the personal experience and then moving into that has changed your practice or how you show up? I mean, to me, you've been brilliant before this happened, because I've always felt, and Janie too, your heart and authenticity, and it's a gift. And your willingness to truly try to hold space with presence. And we're all human and we're better on it some days than others, but it's felt.
Wow.
But I just want to invite you, any other reflections around that?
Well, it's true. It was about a year and a half after I finished treatment that COVID hit. And COVID was very scary in the early days. I mean, we didn't know what Janie had just written her book, which is called Radical Acts of Love. And it was being published. It was coming out. We were actually in the UK for her book tour and her introduction of this amazing book. And COVID hit, and we actually had to, she had done a couple of her big book presentations and conferences, and then had to cancel over half of it. And then we had to actually decide, Justin Trudeau was saying, get back, we might close the airport. So we're it was shocking. And we had to fly back earlier and try and get flights. And it was quite stressful, to say the least. And then I had to go straight back into work, not kind of knowing, whoa. And I'm absolutely grateful for my work in the sense that I have never had to do a Zoom visit. Because I work in the hospital and my patients are in the hospital, I was able to keep going to work every day through the pandemic. And although it was scary in the early days. And, initially we heard one of the Chinese doctors died. So, and we'd heard that in SARS, some of the physicians had died. So it was certainly scary. I felt my immune system was probably fine, but I felt slightly vulnerable, having just had cancer. But we just put our scrubs on and our masks, and we kind of did what they told us to do, and just kind of did it. And the thing was, I realized coming through it is I was so proud of my colleagues, that did do that. We had no choice, but we did, and we did it because we just did it, and we all came together as a team. My palliative care team, again, can't tell you how beautiful it is, but that's what got me through. I think if I was alone at home on a Zoom thing talking to patients, I would have gone crazy. I love my team. And so I got to go to work and be with my team, and we could be all kind of slightly scared together and finding our way together. And it made an enormous difference for me to be with people and to carry on with my work. And in fact, I wrote a letter to the college a year and a half while into the pandemic, once we'd had the vaccinations and everyone should have been back to work. I have amazing colleagues that worked through this. And then I have some colleagues that I was so heartbroken about the way they were working, because I saw patients getting late diagnoses because they weren't seen, they weren't touched, they weren't getting the care that they deserved. And I felt that a lot of physicians should have been back to work, and they should have been touching their patients, and they were just not doing what they should do. And I was so upset about it. I wrote to the college and I said, I think we should start paying doctors 1/3 if they only use 1 cent if they're talking to the patient. We can pay them 2/3 if they actually look at them with Zoom, and don't pay them full unless they touch them. Like, I just felt like this is not okay. And it's not okay for care. Like, we can't be doctors without seeing and touching and relating to our patients in that human way. And it really broke my heart for patients and for doctors to be working in that way. And as I say, it wasn't all my colleagues. I had, for the most part, there were amazing docs kind of doing it the way I felt it should be done. But there were many that weren't doing it the way I felt should be done, and still probably aren't. And I think we did learn a lot about, telemed and all this, which is fine for a little bit of your work, but I just feel like we're missing it if we don't see our patients. Anyways, that's a little bit of a rant, but that being said, I felt that COVID, again, it broke down the walls of us and them. We were all in it together. We could get COVID, you can get COVID. It was like somehow it, again, having cancer, it made anything that can make us more similar, I think, is helpful to how we care for people. What would we want? How do we want to be treated? So for all the sort of negative aspects of COVID, for me, there were many positive ones too. I feel even closer to my palliative care team, and proud and closer to my emerge colleagues and the internal med docs who just worked so day and night, and it was difficult work. I just have a lot of admiration for many of my colleagues, put it that way.
Yeah. It's beautiful.
Yeah.
So I'm going to touch on, and actually, I'm going to touch on the reason we called Healing and Healing Connections, because of a beautiful article that was written, and I just put my glasses on here, that was actually published in the Journal of Pain and Symptom Management in 2007. It was titled Healing Connections on Moving from Suffering to a Sense of Well-Being. And it was authored by, who we love, Dr. Balford Mount, who was a pioneer in palliative medicine and coined the term, Patricia Boston and Robin Cohen. And it touches on 4 types of healing connections that when they're supported, they can enhance quality of life. And so I've fallen in love with this article, because I tell everyone, I refer to it in so many presentations. It just shows the grace and the wisdom of some of the pioneers in the foundational years, the whole idea of whole person care, and this is woven in. But there's 4 key areas of healing connections, and I'm going to name them, not to be prescriptive, But you've already touched on all of them in the stories that you've just shared. But you also do it beautifully as a physician, and you do it beautifully as Callanish, which is Callanish, so I want to bring it up. So that 4 areas are when people were supported in these areas of connection and a sense of bonding, they did much better. And so it's a connection to self, knowing yourself. Again, you've talked about this in your own journey through meditation, dreams, writing as an example, with others. You beautifully shared that in community and secured attachments. People do better when connected. The phenomenal world, which is the senses. Callanish is known for its food and its art, and nature is a big one, or music or sports. And then ultimate meaning, because I know the pioneers in the existential realm were influenced in my beautiful interview with Dr. Balfour Mount, which I wish everyone could watch because of his gracious wisdom. He was influenced by Viktor Frankl, who wrote Man's Search for Meaning and emerged out of the concentration camps with a sense of purpose and meaning, even from that experience we can't even imagine. So I just want to put that over to you and just give you a moment to touch on each one. I mean, I was going to do it a little more linear, but I think I'm going to move that away because you've touched on it so organically in the conversation. But to you, how important are these beautiful healing connections that he's discussed with self, others, the phenomenal world, and finding ultimate meaning, which of course is going to be unique to each person. Mm-hmm. Can you speak to that and how you've witnessed that in your work?
Definitely. And actually, that is the basis of why we started Callanish. Mm. And, whether it's Bal's article or Michael Lerner's book talks about conditions for healing. Mm-hmm. And all of those would be in the conditions for healing. And so that's the whole person, right? That's where at the base of it. So we were trying to figure out how can we bring all those conditions and into play, and how can we set something up that would encourage those or hold those. And so, I see that on retreat where we have phenomenal world is amazing. We have a beautiful setting. We have
Squamish, right? Up by Whistler.
Right up by Whistler. It's an absolutely beautiful setting on a creek. Huge old cedars on the property. It's just a stunning, setting, and we have that. We've got amazing food, all the healthy, beautiful food, music. We do meditation. We have touch. Incorporated many of the aspects of the Commonweal retreats, but that they're exactly what Bal's talking about in terms of what's healing, what's helpful, everything that helps us find our way home. And so the self, how do we get to know ourselves more? How do we touch into that place? Because I think that's the place when we can get at home there and know ourselves. I think that's what helps us when we're dying, mm-hmm. because we're not as afraid and don't feel alone when we truly know ourselves and feel connected to a larger world. So the self in a real way comes with connection, because I don't think if we truly know ourselves, we know we are connected to something larger than ourselves. And I think those things is what helps us have peace at the end of life. And I just think that anything we can do to help people touch more into that's what healing is. And that's what will serve us, whether we're cured or whether we're hoping to stay well and not have a recurrence, or if we've had a recurrence and we're looking at our death. Because people will come on retreat and be quite ill. And in fact, just two retreats ago, we had a beautiful woman who was very short of breath. I think probably almost more short of breath than I've seen. And she came on retreat, brought oxygen, wanted to be there. I worked with her during the retreat, And she could say, my body is getting weaker, but my spirit is getting strong. She could feel, despite getting closer to the end of her life, despite her feeling her body changing, she was feeling stronger and could actually say she felt joy. So it can be profoundly touching to witness that and to be part of that process. And I think that's what's kept me in this retreat work we've done, I think, 104 week-long retreats now. And I've been blessed to be able to be at every single one. Even through my treatment, I was able to be at every retreat. So the self, the connection, the phenomenal world, and then finding meaning, all those things help us find our meaning, our purpose. When we feel connected, when we know our deepest self, and when we have the abundance of beauty and all those things that can help us be still and sense that. Mm-hmm. That's, I think that just is what serves us at the end of life. And that's what it comes down to when people are dying. They want to feel loved. They want to feel their life has had meaning. And that's what helps us kind of, I think, be able to let go too. So I think those things that's a fundamental reason we're on the planet, is to find our way, to find those things, and whoever and whatever methods can help us do that. And we all find our way there in different ways, right? Yeah.
Well, and I just want to also say too, I mean, we're clearly spoiled in British Columbia with the beauty of nature and all the natural world that's around us, and the awareness in the community. There might be somebody watching saying, well, I live in the city and there's no parks, or I only have one friend, or, it doesn't have to be a big, grand thing. It can be just, the respect of the beauty of the flower in the potted plant in the room where you live, or the one cherished partner or friend who you feel secure with to share with. So can we just speak a little bit to that too? It's just in the simple things, and even one connection or one moment that touches you in its simplicity can be more profound than, and you honor all of that in your programs profoundly, so the simplicity and the moment. But it just in case there's people listening that say, well, I'm not as resourced as she is, and I live in this place. What are the words of invitation around just the moment, I guess?
It is in the moment. And I think for me in my work, the more I can just be quiet, I think I try and teach my residents, less is more, and be as quiet as we can, just to, again, you're right, it doesn't have to be big and huge. It can be the simplest things, but I think we have to be quiet and still to notice those and to figure out what is helpful for us in our individual situation. And I just remember I had a patient that was very ill and very kind of turning in, and the staff, we were having a really hard time connecting. And she had young children, and it was hard to just talk about it and even see them because of how ill she was. But I remember one day just sitting at the bedside, and she was sleeping. And again, I could have just left, and I thought, I wonder if she really needs to sleep or if I should wake her. And I was just sitting there trying to decide. And fortunately, a nurse walked in and she had to do something. So she said her name, and she woke up. And so I was like, oh, and there I was sitting there. And so I think I just said something as simply as, well, I realize I've heard about your kids, but I don't think I know their names. Mm-hmm. And anyways, she just, because I wasn't sure, everyone said, she doesn't want to go there. She doesn't want to talk much. And then she just told me their names and then started telling me all about them. Mm-hmm. And it was incredible just to have, I mean, I just had the sort of, just the idea to mention her children's names in a gentle kind of way, just to sort of let her know I was interested in her life, even though she seemed too tired to speak. But then she talked and talked and talked about her kids. And it was this beautiful moment, and it was poignant, and there was joy and sorrow, but she just suddenly went there. And I don't think any of us had that long a conversation in her whole admission. So it's just just finding a moment of connection, and we don't know what that's going to be. And on another given day, that may not have worked, but for whatever reason, on that day, that moment of connection and just feeling her spirit move in her, and just knowing how much she loved her children. It was just a beautiful moment. And for me, certainly, I hope it was therapeutic for her. It certainly felt that in our connection. But it was certainly therapeutic and beautiful for me. And I just think that the moments can be that simple. And sometimes it's not even saying anything. It's like sitting with Gord and just being present in case. And just, I think and I notice that with families, often when someone's close to death, and families haven't experienced that much, and they're nervous, and they're watching, and they're worrying, and they're wondering if something needs to be done. And if you can just come in really calmly and I like to just sit down with them as much as I can. I sit right with them, and I don't launch into saying much right away. I just sit with them and look at them. And then they can see that I'm not anxious about what's happening, that it is natural. And then I can just not panic about it. And then I can start talking to them. So sometimes it's just connecting in the quiet space that is helpful, to just let things be. With dying, it is a natural process, and our bodies have an innate knowledge how to die. We're born with that. And I think sometimes we don't see it enough in our life up till our death, that we don't trust it. Especially now with MAID, we don't necessarily see it, we don't necessarily see that part as much. And I think we just have this innate knowledge, and that we can forget that. Yeah.
Well, and I love that you said when you're calm, and even in the silence. I know for me, with my husband in my hospice work, but even the volunteers who've done vigil with people who are unresponsive, that they don't even know. They've come back to me sometimes when I was in my positions and said, that was one of the most transformative moments of my life. Because this silence was textured to a depth I didn't know was even possible. And by being present, even in the silence with that person, I was changed. It's quite profound. Yeah. Most people haven't experienced that, but when you have, it's rich, right?
Yeah.
So we're coming to the end here a little bit, but I wanted to just touch on mystery. I know Rachel talks about it a lot. I wrote a book about life is a mystery. We don't know all the dimensions of it. So how do you embrace mystery in your life and work and honor mystery?
Wow, that's a good question. Wow. Well,
it's a big question.
A big question. There is so much mystery, and so much we don't understand about why things happen and what lies ahead. But I mean, I think the mystery is what draws me to this work in particular. Like, what draws me to this work? I think it is mystery. And I think I'm more comfortable not knowing sometimes than knowing. it's interesting. I find that some of my residents are more comfortable in the medicine, the algorithms, and kind of something they can hold on to. And other residents and med students are a little more intrigued by the mystery. And I think that's the difference between sort of the art and the science of medicine. And Rachel talks about that too. And I think the mystery is definitely in the art side, right? Like the create, it's like your left brain, right brain. But I think that the creative, the mystery, the parts we don't fully understand is where the possibility lies, I think. And so, like, I like the gray in palliative care. Like, I like the not necessarily knowing or the having to sort of feel and take time in the mystery of who is this person in this culture at this time, and and how should we try and connect with them? What might be the best and most healing way to do that? And so that's about mystery in a way. It's about not getting in the way of what unfolds and what's there for you that you could miss if you're too quick. Mm-hmm. So I think somehow it sits in that, pausing and taking your time and being present, and then that mystery can arise, and then we can respond from that place. Mm-hmm. And where do we go? Where does that take us? And so just the not knowing, the not knowing makes you have to be more open, right? Mystery makes you have to be more open. And I mean, life is a big mystery. I mean, we there's so little that we can be certain that we'll die sometime. And in terms of everything else, there's not a lot of certainty. We live as if there's certainty. Our whole life is a mystery. Mm-hmm. I mean, almost every moment, really. We just pretend that it isn't.
That's true. You know what I mean? So it sort of soothes us, but it's a big not truth, right?
It is a big mystery, honestly. Whether how you. I remember my mother-in-law who just recently passed, and I'm just recently agreed. But I used to say, "Night, Nance," and see you in the morning. She goes, "If I'm spared." Like, she didn't know if she'd make it through the night. But it's like, honestly, life is a huge mystery. What the problem is that we don't get that, and we think we can control everything. That we should control everything. And I think the more we can be open to the fact that there is so much that we don't control and we don't understand, and again, the way that we can slow down, not get in our own way, and be open to it, we just learn more about ourselves in those moments than we do in most other ways, And you can just be so surprised by the beauty of an interaction. I've just had so many, it's interesting because I've been in grief this last week of work, and I've just had so many beautiful interactions with my patients. And I think it's because I'm more vulnerable. I'm more in that mystery of life and death, and I'm more open to the beautiful connections that are possible. Mm-hmm. Every moment, like even the stressful moments, you can bring that in if you can. It's just so helpful. Yeah. Mm-hmm. I don't know if I articulated it well, but I'm really feeling it.
Beautifully. And I am aware that you've had a recent family loss, and again, it opens the heart to the mystery in the pain of it. It opens the heart to love and the mystery of life in a different way. So I'm even grateful that you're willing to come on in the midst of that tender life transition that you're in too, right? So, mm-hmm. And you did express it beautifully, Daphne. Thank you. So one last question, my signature question.
Okay, I'm ready.
And you've already really touched on it throughout the conversation, but How have you been changed, or have you been changed by this work? Not just the illness that you've been through, but the work itself.
Oh, I've been dramatically changed by the work. And that's such a good question. I think that again, it kind of relates to much of what we've been talking about. But I think one of the things that the cancer experience, I remember sitting on my couch one day in the midst of chemo, and I just had this feeling come over me that I'll be okay if I die. Like, it was this really, I wasn't, again, I knew that I had early stage cancer and that I'd likely be cured, but for some reason, I just had this profound feeling that I'll be okay if I die, or not if, there's not an if, I'll be okay when I die. And it was profoundly comforting. And I remember thinking, wow, the cancer's given me that. But I think it's not only the cancer, it's being with the families and the patients that I get to be with day in and day out, and watching that process. I think that my understanding and my comfort with death has been one of my greatest gifts from this work, and hopefully one that will sort of ultimately serve me more than anything. And that, coupled with how important love is. Love and gratitude through my cancer journey was what grounded me and saved me. And that's what saves me and grounds me in life. And the notion of loving your patients. I love my patients. I do. And that's, I think, another one of my greatest gifts and learnings throughout my work and my life with Janie and my Callanish world, and is that just being out there with your love too. Yeah. Yeah. So I would say I would answer your question in that way.
It's beautiful, Daphne. So I can't thank you enough for coming. You and Janie. Janie was brave to be my first guest. Yeah, she was the first guest. She was courageous. And her book, Radical Acts of Love, had just come out, and it's a stunning book too. So Callanish, as you said, is a cancer support center and counseling center, and you do retreats and support individuals with the illness and their families. So I want to let the audience know, if they want to know more about your work and connect with you or Janie, they can go to www.callanish.org, and we'll put the link in the YouTube notes. But I'm just so grateful to know you and her, and have been touched by your example in my life. Get emotional.
Well, thank you, Barbara. Thank
you. Just grateful that you're part of my life and the community that we're in here, because we really do have a special community in the Vancouver area, I feel. So thank you so much for coming on today. This is a rich conversation, and I wish you well going forward in future too. So
thanks, Barb. Thank you too for your work. Like, I feel we're in it together, always have. And I was just so touched to meet you when I did at such a vulnerable time, and you and Gord, so beautiful there, and to continue that connection with you over all these years, and then now you doing this important work. I've always known you're out there advancing love and care and awareness and heart. So carry on, and thank you.
Going to leave crying, right? But thanks so much, Daphne. I really appreciate this.